Shoulder replacement is predominantly we do of three types. One is a hemiarthroplasty, second is a total arthroplasty, total shoulder arthroplasty, and third is reverse shoulder arthroplasty. Hemiarthroplasty is usually done in two cases most commonly. Number one, it is a traumatic condition, and number two, it's tumor. So if you have a proximal humerus tumor, you can do a hemiarthroplasty. And number two, if you have a trauma, or if you have a four-part fracture, dislocation, or anything which cannot be reconstructed, then we can do a hemiarthroplasty. The ratio of hemiarthroplasty nowadays is going down because nowadays better results can be obtained by a reverse shoulder arthroplasty. So now for these two indications also, for tumor and trauma, both you can do a reverse shoulder arthroplasty to improve your outcomes, because if you do a hemi replacement arthroplasty for both of these conditions, the results or the function of the shoulder will not be as good as a reverse shoulder arthroplasty. The second is a total shoulder arthroplasty. Total shoulder arthroplasty is done in those cases in which you have an intact rotator cuff and you are having a primary osteoarthritis or a primary rheumatoid arthritis. But if it is a rheumatoid arthritis, you have to make it a double sure that your rotator cuff is intact. You need to make sure that the acromiohumeral distance is maintained on the X-ray, and if you are on the doubt in X-ray, you have to do an MRI scan to see, because if your rotator cuff is not functional, the total shoulder arthroplasty surgery is not going to work. So osteoarthritis, rheumatoid arthritis with preserved rotator cuff, no damage to the rotator cuff, intact structurally and functionally rotator cuff, then only you can do a total shoulder arthroplasty. Also, if you have a very severe osteoarthritis or a rheumatoid arthritis in which you have a lot of bone loss on the glenoid side, then also it is recommended that rather than doing a total shoulder arthroplasty, you can do a reverse shoulder arthroplasty. Specifically, total shoulder arthroplasty is relatively recommended for a more younger population as compared to a older population. In rest all of the scenarios in present era, reverse shoulder arthroplasty is the final choice. First indication is a reverse shoulder arthroplasty is a rotator cuff tear arthropathy. Then you can do it in osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, as I told you, tumor cases and trauma cases, and lastly in all bad kind of a cases, all neglected kind of a shoulder cases, or all failed kind of a shoulder cases. If you have some shoulder surgery done and it is not successful, then we can plan and do these kind of a reverse shoulder arthroplasty cases. Now, reverse shoulder arthroplasty has developed a lot in the past years. So there are very much changes in the definition or in the design of the reverse shoulder prosthesis with time. Presently, the prostheses that we are using are unsymmetric ones, and they are unsymmetric for the glenoid and unsymmetric for the humerus. Predominantly, we like to use a hydroxyapatite coated or some kind of a coated stem for both glenoid and humerus. Apart from the cases in which there is a fracture or tumors, rest of the cases cement is not needed. If you have a fracture case, then you can use a humeral stem with a cement. In rest of the cases, you can do a uncemented reverse shoulder arthroplasty very much successfully. Reverse shoulder arthroplasty usually relies on the deltoid tension, and you need to increase the vertical as well as the horizontal offset to increase the tension of the deltoid. So even if you don't have a rotator cuff, you will have a very good function in the shoulder in absence of rotator cuff also. So that is why it has got very good function in tumors and trauma cases as well, where you have to cut or you have to remove the rotator cuff tendons also. Biggest complication after a reverse shoulder arthroplasty is a dislocation, or a most common complication is dislocation. So you have to keep the soft tissue tensions right and maintain your vertical and horizontal offset. So these are the important things that you need to consider while doing a reverse shoulder arthroplasty. Thank you. Any questions?
Yes, sir. One question, sir. So in case of osteoporotic bone also, can you go for unsymmetric or in that case?
Yes. If you have a osteoarthritis or rheumatoid arthritis with an osteoporotic bone, you can still go on with an unsymmetric bone, unsymmetric humeral prosthesis safely. For glenoid, anyway, it's a screws, multiple screws, so it does not matter. You have a very good purchase most of the time. So most of the times unsymmetric prosthesis is successful. Apart from, as I told you, trauma cases, because this is an unsymmetric prosthesis, the coated surface is in the metaphyseal. So it's a metaphyseal fit. So it does not fit in the diaphysis. So if you have a good metaphysis, then it will fit nicely. So it's a metaphyseal fit unsymmetric stem.
If the humeral component adjusts proximally, does it impede the acquirement process?
So in reverse shoulder arthroplasty, very less chances of impingement because it will go down. Actually, you increase the vertical offset, so the shoulder will go down. Actually, you will have lengthening. So the arm will be lengthened as compared to the opposite leg about 1 to 2 centimeters. So very less chances of impingement. You have the reverse problem. You have the problem of notching inferiorly. So what is notching? Notching is basically you have a wear on the inferior aspect of the glenoid, and this is because of the prosthesis, and this is more with a 155-degree prosthesis, the olden design prosthesis. With the newer design prosthesis, the chances of notching has reduced, and all notching is not symptomatic. So little bit of notching, if you see on X-ray, notching is basically wear or loss of the bone at the inferior margin of the glenoid. So that is commonly seen, but it is not always symptomatic. So you don't need to worry about it always.
So in case of reverse shoulder, can the patient continue with the overhead activities?
Yes, very good function actually. With reverse shoulder, the patient will get very good function, including the overhead activities, and all the activities that you want to do are better preserved. So that's why, as I told you, the ratio of hemi versus reverse is increasing. The ratio of total versus reverse is increasing a lot. So in my practice, most of the time these days, the final answer will be a reverse shoulder prosthesis as compared to a total shoulder prosthesis.
Does the patient work heavy work or?
Yes, patient can do heavy work. So some of our patients are like sportsmen also. We have done a patient who was a merchant navy official, and he goes back to his work of driving ships and all. So he can do heavy works also. The longevity is not very much tested at present, but we can say it is around 10 to 15 years usually. But usually with this unsymmetric prosthesis, a better longevity as compared to the older generation.
So and the revision surgery can also be done like after 10 to 15 years?
Yes, we can. We can do a revision surgery. So these revision prostheses are also available for these joints. There are 3 major companies which are into. One is Zimmer Biomet. DAPU has got the olden design. It's more of a cemented version, 155-degree angle. This I told you. DAPU is the older one, which is actually it is a prototype of reverse. Then the newer designs are from Zimmer Biomet, that is comprehensive. One is from Evolutis, and third is from Exarec. So these are the more. Then one is from Arthroplasty. So these are the 4-5 companies which are commonly into the Indian market.
So what is the angle that is used nowadays?
135. 135 is nowadays. Earlier it was a more flat design. So it was 155. It has got more vertical offset and less horizontal offset. So nowadays it is vertical and horizontal both. So with older design, the chances of notching were more. With the newer design, the chances of notching have reduced.